Former President Joe Biden and his family are thanking supporters for their well wishes after Biden's cancer diagnosis.
Doctors, as we've been telling you, say he has an aggressive form of prostate cancer that has now spread to the bone. The Bidens are considering their options right now. This cancer appears to be hormone sensitive, which makes hormone therapy a possibility. Oncologists say the cancer is treatable but not curable. So many are now questioning how a cancer this far along was not caught earlier. One of the key ways to test for prostate cancer, the PSA blood test, is not typically recommended for men who are over 70. In his message of gratitude to supporters, the president highlighted that cancer touches all of us. Here at News Center Maine, anchor Lee Goldberg was diagnosed with prostate cancer and has been successfully treated.
Lee had no symptoms before his diagnosis. A doctor found it through one of those PSA tests. This morning, Lee talked with his urologist, Dr. Stephen Ryan, about what prostate cancer is and how it's detected.
The prostate gland is a little walnut-sized organ that sits in between your urethra and your bladder, and its entire job is actually to process and activate semen for the purposes of reproduction.
So that cancer, like any cancer that we talk about, early detection to finding out you have it can certainly be the key in what your treatment options might be, your survival rate, and all the things that follow that. So early detection for prostate cancer is best found how?
Yeah, the best way to detect prostate cancer is actually a PSA test. It's a simple blood lab. Usually men from the ages of about 50 to 70 should get one of those within that time period. Doesn't necessarily need to be done every year, but even every other year or once every 3 to 4 years could detect prostate cancer many years before you actually develop symptoms.
Yeah, and that's one of the things that I don't know if people understand about prostate cancer. It's known as a slow-growing cancer. It takes its time. So and I'm certainly not going to ask you to talk about the president because I know he's not your patient. But to get to the level of where he's at, it would take a long time to have first gotten it to get there. So even more enforcing why early detection is so important, because something that grows so slowly, if caught early, can be treated.
Yeah, most prostate cancers in their early state can be treated and cured. And in situations where even late-stage prostate cancer is detected, they can still be treated and managed. So knowing about the prostate cancer and then kind of understanding what its implications are will help you decide, what course of treatment and what could be done. And another thing to say is it's not just surgery, remove your prostate, there's also radiation. And in these advanced forms, there's hormone therapy that can really tamp it down and make sure to control all symptoms before they develop.
So Lee and Dr. Ryan founded a nonprofit with their spouses. It's called Prostate Cancer Maine. You can find more resources about it on our website and mobile app.